SecurAcath because since I joined this team, that's all we've ever used. That's all we've ever needed. It's effective. So we haven't really had to look at any other product because this one works all the time, every time.
For our facility, it has reduced CLABSIs quite a bit.
In our review of almost 8,000 patients with PICC lines and the collapsing rates of those, we feel that micropistoning, that movement in, that movement out, increased the potential risk of infection. And our study, I think, at least the numbers prove that that is a true statement. But the key is that 288% increased risk by using an adhesive device over the subcutaneous device.
We take great pride in making sure we're sterile and the patient is safe. And when I send them out into the community, because of SecurAcath, I know that line stays exactly where I put it.
So we noticed a big change with SecurAcath in really decreasing the number of issues we have with the PICC lines in community. So patients don't need to come back here because of a malpositioned PICC. The line stays really secure for the entire treatment course.
Once I put a line in, it needs to stay in for the duration of the treatment, and we don't know how long that might be. And with SecurAcath, the migration has completely stopped.
When you take off the dressing, there is no need to worry because the line is being held in place, literally held in place for the life of the line.
What I love SecurAcath for is the ease of dressing change on a pediatric patient where we know that they are really mobile and don't enjoy the dressing change process. So when we use SecurAcath, it makes the nurse doing the dressing change feel so much more confident in that because it reduces the risk of line dislodgement.
In real life scenarios, patients move around, they twitch, they get up, they walk, they run, and we need the line to be held in place. SecurAcath holds the line in for the life of the line.
Compared to the stat lock, we just have a lot less pullback issues, and patients able to, I think, move around and keep it in place a lot easier than with the old way with the stat lock.
For me as an inserter, I feel it provides increased security in the catheters that I'm inserting, and then I can send them out onto the ward with a higher degree of confidence that they're not going to dislodge. There's small amounts of dislodgement can make a big difference, especially in our really tiny neonatal patients.
If you think about the number of adhesive devices that you need for the life of a line, whether it is a routine therapy, a very short therapy, or a very long therapy, there is still that risk for dislodgement with the adhesive devices. And I think the one time and of that cost of the SecurAcath anchor is worth it because you never have to worry about having a dislodgement or a malposition.
It's so easy to use. Only take a couple seconds to put the SecurAcath next to the PICC line.
Initially, because I'm new here, I said, oh, how got this done? How to do this thing? But explain, and then, oh, it's absolutely easy. It just took and I thought it would bleed, and no bleeding. I was so amazed.
It's pretty much low maintenance. With the stat lock, you have to replace it. With the glue, you have to replace it. With SecurAcath, once it's in, it's in.
There's improvement in the skin integrity around the PICC line because we're not using a lot of extra tapes or different adhesives underneath the PICC dressing as well. And I know community nurses really like how easy it is to take care of the PICC line for home care patients as well.
The thing about hospital in the home is that you've got a lot of uncontrollable things happening. You've got dogs and cats, and so I found the SecurAcath
much better because you've got less things to control then to keep your area clean, and it's a more seamless dressing change when you've got other things happening around you.
This device has really increased the confidence for the nurses doing dressing changes or doing assessments, which they're supposed to be doing every day, and really ensuring that the line is not moving. And during that dressing change procedure, which can cause a lot of anxiety, they are assured that it's not moving and they feel more confident, so they can fully clean 360 degrees around that site, and there's less risk for infection, contamination, and they feel confident when they're reapplying a new dressing.
During that dressing change process, it's of particular interest to be able to clean right around that site and provide a good clean. In our patients who are mobile, not always terribly compliant in this scary procedure, clinicians generally want to get it done quickly to reduce that risk of dislodgement. And in the process, sometimes that is at the expense of cleaning. So we know that with this, the securement, but also the allowance to be able to clean 360 degrees around the insertion site allows us probably better care outcomes.
Nurses at the bedside particularly love it because when they do dressing changes every 7 days for our facility, they can lift the line up, they can clean around it 360 degrees. The line will definitely not migrate. They can redress it and feel secure knowing that the line will be held in place.
Very, very easy to clean around the site without the risk of dislodgement or malpositioning, which makes the nurses more comfortable in actually doing the best proper, clean and care for the site.
Sutures can be, they're so problematic. I take them out as soon as that patient needs a dressing change. I take those sutures out immediately. Some physicians suture those lines in so tight, there's so much pain, and you can't clean the site, you can't clean the line, and it's just very problematic.
I definitely prefer removing the line that has a SecurAcath in situ over sutures. Just a lot safer in terms of not cutting the patient or yourself.
Today, we know and we have seen that SecurAcath reduces needle stick injuries. Our team is responsible for teaching residents, helping them to learn how to place central lines, temporary dialysis catheters, art lines, mid lines, that kind of thing. And we have seen accidental needle sticks in real life. We know for a fact that SecurAcath reduces needle sticks. The residents are actually very happy and very comfortable once they are trained to use it, because it's way faster than actually putting sutures in.
Why wouldn't you use SecurAcath? It's the best thing out there for our patients. I can't imagine using sutures, stat lock, anything like that again. We've been using SecurAcath for 5 years almost, and it's been phenomenal for our patients. We've had several patients extremely satisfied because their lines aren't falling out anymore. We have 0 CLABSIs to date this year with our team. I can't imagine using anything else for securement of our lines.
At first, when I first saw the product, I wasn't sold. That was a few years ago. And then I noticed how many people who are very big influencers in vascular access were using the product. And then my final time came when I was in the ICU doing a dressing change, and I dislodged a line 1 centimeter. And I thought, okay, enough is enough. It doesn't matter how good you are. Sometimes we dislodge lines and it's very frustrating. So if you are on the fence about SecurAcath, I'd say trial it. I mean, you have great support with the SecurAcath team, and there's really nothing to lose, especially your line.